Did you know that after 65, the risk of diabetes increases to over 33%? And many seniors will live with it until it's too late. But the good thing is that there are signs to watch out for. And if you catch the signs early and do something about it, you can live a much better life. That's why in this video, we'll count down the 10 most dangerous diabetes warning signs every senior needs to know. We'll start at the least dangerous to the most dangerous. And make sure to stick around, because the last warning sign can escalate into a medical crisis in minutes if you don't act fast. But before we dive in, let us know in the comments below, how many people do you know that have diabetes? And how has their life changed since finding out? Now let's start with the first sign that you might think is due to aging. Warning sign number 1 is blurry vision. Blurry vision might seem like just a nuisance, but for seniors over 65, especially those at risk for or already managing diabetes, it can be an early warning sign that your blood sugar is out of control. When blood sugar levels rise too high or drop too low, it changes the fluid levels in your eyes. That sudden shift affects the shape of the eye lens, which then alters how clearly you can see. One day, everything looks fine, and the next day, words on a page or faces across the room might suddenly seem fuzzy or distorted. It's not just about getting older or needing new glasses. This kind of vision change can signal that something more serious is happening inside your body. Many people brush it off and think they just need stronger reading glasses. But if your vision keeps getting blurry, especially off and on throughout the day, it could mean your blood sugar is swinging dramatically. Over time, high blood sugar starts damaging the tiny blood vessels in the retina, the part of the eye that helps you see detail. This leads to a condition called diabetic retinopathy. At first, it may not hurt or feel like a big deal, but left untreated, it can lead to permanent vision loss or even blindness. Blurry vision caused by diabetes doesn't just show up in one eye. It can affect both. Some people notice they have trouble focusing when trying to read, while others say it's harder to drive at night or recognize faces in dim light. If your eyes seem fine in the morning but blur up by afternoon, that's another clue that your glucose levels might be jumping around more than you realize. Getting your eyes checked regularly is one of the best ways to catch diabetes-related problems early. An eye doctor can spot damage to the blood vessels before you notice symptoms. They might even catch signs of diabetes before your regular doctor does. And if you already have diabetes, keeping your blood sugar in a steady, healthy range can actually reverse some vision changes if you catch them in time. Warning sign number 2 is dark, velvety patches on the skin. These patches may feel thicker, almost like suede, and they often appear gradually without any pain or itching. For seniors over 65, this skin change can be a sign that your insulin levels are off, and it may be one of the first visible warning signs of type 2 diabetes. The condition is called acanthosis nigricans, and while the name sounds complicated, it's actually your body's way of waving a red flag. What's happening under the surface is that too much insulin is circulating in your bloodstream. When your body becomes resistant to insulin, something that tends to happen more often as you age or gain weight, it starts producing even more to try and keep blood sugar in check. That overload of insulin can cause skin cells to grow and reproduce faster than normal, especially in folds of skin. As more cells pile up, they trap extra pigment, leading to those darkened areas. Many people mistake these patches for leftover dirt, or they think they've just developed some kind of skin irritation. But scrubbing doesn't make them go away. What makes them fade in most cases is treating the underlying cause: high insulin and blood sugar levels. Left unchecked, this warning sign can be the first step toward full-blown diabetes and the complications that come with it, like nerve damage, kidney strain, and heart problems. Acanthosis nigricans itself isn't dangerous, but the message it's sending absolutely is. It's your skin's way of saying, hey, something's wrong with how your body handles sugar. And for seniors, catching this early can be a game changer. Adjusting your diet, managing your weight, or starting a new medication can make a big difference, not just for your skin, but for your overall health. Warning sign number 3 is increased hunger after eating. If you're finding yourself hungry again just an hour or two after a full meal, especially if it's happening often, that could be a major red flag. For seniors over 65, this type of constant hunger, called polyphagia, can be one of the earliest warning signs of diabetes. What makes it tricky is that most people don't connect the dots. They assume they didn't eat enough, or maybe they just have a fast metabolism. But what's really happening is that your body isn't processing sugar the way it should. In a healthy system, your body takes the food you eat and breaks it down into glucose, which your cells use for energy. But if you have diabetes, or if you're in the early stages of insulin resistance, your cells can't absorb that glucose properly. The sugar builds up in your blood instead of getting where it's supposed to go. And even though your stomach is technically full, your cells are still starving for fuel. That sends a signal back to your brain saying, "We need more food," and the hunger kicks in again. This becomes a frustrating loop. You eat more to satisfy your hunger, but your body still can't use the energy properly. So the cycle repeats. Over time, you may notice you're gaining weight even though your diet hasn't changed much. Or you may feel tired despite eating regularly. That's because the energy isn't getting to the places that need it: your muscles, brain, and other organs. For older adults, this can lead to sudden fatigue, mental fog, and an overall drop in strength and motivation. This kind of hunger is also different from emotional eating or boredom snacking. It feels urgent. You may finish a balanced meal and still feel an almost desperate need to eat again, sometimes reaching for sweets or carbs without even thinking. That craving for quick energy is your body's way of trying to compensate for the sugar that's stuck in your bloodstream instead of reaching your cells. If you notice this pattern, frequent hunger after eating, unexplained weight gain, or constant fatigue, it's time to take it seriously. Seniors are especially at risk for type 2 diabetes, and the sooner you identify these signs, the easier it is to manage. Blood tests can confirm what's going on, and small changes in diet, exercise, and medication can help break the cycle before it causes lasting damage. Warning sign number 4 is tingling or numbness in hands and feet. The condition is known as diabetic neuropathy, and it often shows up quietly, starting as a light pins and needles feeling that comes and goes. But over time, it can grow into constant numbness, sharp pain, or even loss of sensation altogether. This happens because high blood sugar levels damage the small blood vessels that supply oxygen and nutrients to your nerves. When those nerves start to break down, they can't send proper signals to your brain. That's why some people feel tingling, while others feel nothing at all, especially in their feet. And that's where the danger really starts. If you can't feel a blister, a small cut, or even a pebble in your shoe, that little issue can turn into a major infection without you even noticing. In fact, diabetic foot complications are one of the leading causes of hospital visits and amputations in older adults. Many seniors dismiss the early signs of neuropathy because they assume it's due to arthritis, circulation issues, or just plain aging. But the difference with diabetes-related nerve damage is that it gets worse if left untreated. And once it sets in, the damage is hard to reverse. You might also find it harder to balance, especially at night when your feet can't feel the floor the way they used to. That can make you more likely to trip, fall, or injure yourself while doing something as simple as walking to the bathroom. What makes this symptom especially tricky is that it doesn't always hurt. In fact, some people feel no pain at all, just a strange numbness or sense that their feet are wrapped in cotton. But even without pain, the underlying damage is still happening. And that damage isn't just limited to the feet. It can affect your hands too, making everyday tasks like buttoning a shirt, holding a fork, or opening a bottle much harder. The good news is, if you catch it early and manage your blood sugar levels, you can slow down or even stop the progression of nerve damage. But if you ignore it, the numbness can spread, the pain can intensify, and your risk of infections, ulcers, and falls skyrockets. Warning sign number 5 is increased thirst and frequent urination. When your blood sugar gets too high, your kidneys try to flush out the excess glucose by making more urine. So, the more sugar that builds up, the more your body tries to get rid of it. That means you're urinating more, and as a result, you're losing a lot of fluid. Your body then sends a signal to your brain saying you're dehydrated, so you drink more, which just restarts the cycle. It's like your system is stuck in overdrive, trying to balance itself, but failing every time. This cycle can be especially hard on older adults because aging already affects kidney function and fluid balance. Frequent urination can lead to dehydration, which can then cause dizziness, low energy, dry mouth, or even confusion. And if you're getting up several times a night to pee, it also robs you of deep, restful sleep, which your body needs to heal and regulate hormones like insulin. Many seniors find their sleep quality dropping fast, their legs feeling weaker, or their thinking getting foggier. And they don't realize it all started with too many nighttime bathroom trips. It's also worth mentioning that this symptom combo often comes on slowly. At first, you might not think it's a big deal. Maybe you're just carrying a water bottle more often, or you notice you can't make it through a movie without a bathroom break. But if you start waking up multiple times a night, or you're constantly sipping water without ever feeling satisfied, your body could be trying to tell you that your blood sugar has been too high for too long. And this isn't something to ignore. Unchecked high blood sugar can lead to serious complications like kidney damage, nerve damage, and vision loss. But the earlier you recognize these warning signs, the easier it is to turn things around with a few changes in diet, medication, or lifestyle. Warning sign number 6 is slow healing cuts or bruises. When your blood sugar is too high for too long, it damages the tiny blood vessels that supply oxygen and nutrients to your tissues. Without enough blood flow, your skin and muscles don't get the fuel they need to heal properly. That's why a simple scratch, a nick from shaving, or a small bruise on your arm can stick around for weeks. It's not just annoying, it's dangerous, because those slow healing spots are more likely to become infected, and infections in people with diabetes can quickly turn serious. This problem is especially risky for the feet and lower legs. Many seniors don't realize they've cut themselves because they've lost some sensation due to nerve damage. A blister or scrape goes unnoticed, stays open longer, and becomes the perfect environment for bacteria. And once an infection sets in, the reduced blood flow makes it harder for the immune system to respond. That's how some people go from a small sore to a major wound that won't close, sometimes ending in hospitalization or worse. You might also notice that bruises seem to appear more often, and they don't fade like they used to. That's because fragile blood vessels break more easily when sugar levels are high, and the healing process is much slower. This isn't just a cosmetic issue. It shows that your body is struggling to recover from even the smallest injuries, and that's a major red flag. Sometimes people mistake this for a side effect of a blood thinner or a vitamin deficiency. But if the delayed healing keeps happening, especially alongside other symptoms like increased thirst or tingling in the feet, it could be diabetes working quietly in the background. The longer you wait to get it checked, the more damage it can do. If you've been treating a scratch or sore for a week or more and it still hasn't closed, it's time to take that seriously. Healthy skin should bounce back quickly, and when it doesn't, there's often a bigger reason. Diabetes doesn't always start with dramatic symptoms. It often shows up in slow, subtle ways. But once you recognize the pattern, you can take action before things get worse. Warning sign number 7 is frequent infections. When your blood sugar stays elevated, it feeds the growth of harmful bacteria and yeast. That's why people with undiagnosed or poorly controlled diabetes often notice recurring urinary tract infections. You might feel like you constantly need to go or notice pain, burning, or strange smelling urine. And if the infection keeps coming back even after treatment, it's a strong signal that something deeper is going on. Skin infections are also more common with diabetes. Small cuts can swell up quickly, and rashes or boils might show up without any clear cause. Even minor skin irritations can turn into major problems, especially on the feet, where circulation is already weaker. Fungal infections like athlete's foot or itchy patches in skin folds can also be persistent because the high sugar environment creates the perfect breeding ground for these organisms to grow. Don't overlook what's going on in your mouth either. Inflamed or bleeding gums, frequent mouth sores, or bad breath that doesn't go away can all be signs of gum disease, a condition that's far more common in people with diabetes. That's because elevated glucose levels make it easier for bacteria in the mouth to multiply, leading to swollen tissue, receding gums, and even tooth loss if left untreated. What makes this especially dangerous for older adults is that the symptoms of these infections can seem small at first. You might treat them with over-the-counter creams or antibiotics, but they just keep coming back, and every infection is another strain on your immune system. Over time, repeated infections can lead to complications like kidney damage, chronic wounds, or even sepsis if they spread. Warning sign number 8 is constant fatigue or weakness. Diabetes often creeps in silently, and one of its earliest and most overlooked symptoms is that relentless, drained feeling that just won't go away. Here's what's happening inside your body. When blood sugar is too high, your body struggles to move that sugar into the cells where it can be used for energy. So even though there's plenty of fuel floating around in your bloodstream, your muscles and brain aren't getting the energy they need. It's like trying to drive a car with a full tank of gas, but the engine can't access it. That's why you can feel so wiped out, even after doing something simple, like walking around the house or cooking a meal. You might notice your legs feel heavier, your arms feel weak, or you just want to sit down more than you used to. Many people describe it as a kind of whole-body tiredness, mental fog, mixed with physical exhaustion. And it doesn't matter how much you rest. You can sleep through the night and still wake up feeling like you haven't slept at all. Fatigue from diabetes isn't just physical. It hits your mood and brain too. You may feel more irritable, find it harder to focus, or feel less motivated to do things you used to enjoy. That drop in energy can start a cycle of inactivity. You move less, which makes your blood sugar worse, which makes you even more tired. It's a loop that's easy to fall into and hard to break unless you know what's causing it. Some seniors try to push through this kind of tiredness by drinking more coffee or taking naps throughout the day. Neither of those actually fixes the problem. That underlying weakness and fatigue won't go away until your blood sugar is back in a healthy range. And the longer you ignore it, the more it can wear down your body's systems. Warning sign number 9 is unexplained weight loss. While some might see unplanned weight loss as a pleasant surprise, in reality, it can be a dangerous signal that something is seriously wrong. What's happening inside your body is this. When blood sugar levels stay too high for too long, your cells can't use that sugar for energy. The insulin that's supposed to help sugar enter the cells isn't doing its job properly. So instead, your body starts to break down fat and muscle to get the energy it needs. That's why you might be eating normally, or even more than usual, but still dropping pounds quickly. You're losing muscle mass and fat, not just water weight, and that can make your body weaker and more vulnerable. This kind of weight loss is different from the gradual changes that can come with aging or lifestyle tweaks. It happens faster, and it often comes with other changes like fatigue, frequent urination, or feeling thirsty all the time. You might notice your clothes fitting looser, your belt notching tighter, or even your face looking thinner. And while that might sound good at first, what you're really losing is strength, stability, and in many cases, your immune defense. Unexplained weight loss in older adults can quickly lead to frailty. Less muscle means less balance, slower reaction time, and a higher chance of falling. It also makes it harder for your body to recover from illness or injury. So while it may not seem like a problem in the beginning, over time it chips away at your independence and health. Warning sign number 10 is confusion, dizziness, or fainting spells. Confusion is one of the scariest symptoms because it can come on without warning. You might find yourself forgetting simple things, losing your train of thought mid-sentence, or feeling like you're in a fog that you just can't shake. Some people describe it as not feeling quite like themselves, almost like watching life from the outside. This can happen when blood sugar crashes too low, starving your brain of fuel, or when it spikes so high that it throws your entire system out of rhythm. Dizziness often tags along with these episodes. You could be standing in the kitchen or getting up from your recliner and suddenly feel the room spinning. This isn't just annoying, it's dangerous. Many seniors fall because of a sudden drop in blood pressure or blood sugar, especially after meals or when changing positions. That spinning sensation is your body's warning sign that something inside isn't working right, and diabetes is often the hidden cause. Then there's fainting, the most extreme and alarming signal of all. Losing consciousness, even briefly, means your brain didn't get enough oxygen or energy. That can happen during a blood sugar crash, especially if meals are skipped or insulin levels are off. And if you're living alone or in a place without quick help nearby, one fainting spell can lead to serious injury or worse. What makes this trio of symptoms, confusion, dizziness, and fainting, so dangerous is that they're often chalked up to aging, dehydration, or medications. While those can certainly play a role, if these episodes are happening regularly or getting worse, diabetes should be on the list of possible causes, especially if these symptoms follow eating, exercising, or long periods without food. Final thoughts. Staying aware of diabetes warning signs is crucial for your health, especially if you're over 65. By recognizing these 10 dangerous signs we shared, you can take action early to manage your health and feel better. Start by watching for 1 or 2 of these symptoms and talk to your doctor if you notice them. We hope this video has empowered you to stay proactive about your well-being. And if you like this video, don't forget to subscribe and hit the bell notification so you can be first to know when our next videos come out.